one of the issues, and I'll speak specifically to what we're doing on these sites over here, and we do think that this is going to become more common throughout cities in New Jersey. We'll talk about what we're spending, what the cost is, why we're doing it. But I do want to touch on some of the strain that's in our healthcare system right now. We had our daily call with Christ Hospital today. To give you a little perspective on that, they only have 2 days worth of masks left, is what they say. We're trying to help them out. They have 67 individuals in the hospital that are likely COVID positive. They have 2 ventilators left, and they have 1,000 testing kits arriving this weekend. To put in perspective on the number of testing that they're doing at their location in Bayonne, they're doing about 25, they told us, a day. Today here, we're going to reach our goal today of 200 plus, and we'll gradually scale that up as we're able to get more workers, healthcare professionals, to be a part of this. One of our challenges is around nurses and healthcare professionals that we need to help us operate these. The more people we have involved, the more ability we have to do more tests. We do on the city side, thanks to Greg Kearse, our OEM director, who I'll have speak shortly, we have more than 1,000 PPE units on hand for our first responders. The city's been very proactive on that and ahead of the curve, so I just want to say thank you to Greg publicly for that, and we have about 1,500 more on order. Yesterday, we did give some additional units to Christ Hospital to make sure that they're up to speed on and they have all the tools that they need. Specifically to Christ Hospital, we're exploring a plan there with them to aggregate all of their COVID positive cases into Christ Hospital. And they spoke to the governor's office on that, to have one central location with all the professionals focused specifically on that to combine resources, as opposed to having people going to Bayonne, Hoboken, and Christ. That application went into the governor's office, I believe, yesterday, and they're waiting for some feedback on that. The Jersey City Medical Center is also having capacity issues. As of yesterday, they had 2/3 of their ventilators in use. We're working with them to get more ventilators. Alaris, one of the senior care facilities, reached out yesterday, offered us 20 additional ventilators, and so we're trying to pool resources from all different places, and we're putting them together where possible and matching them with the hospitals that are in need. And we want to say thank you to all the people that have reached out offering help with masks and PPE units and ventilators. Right now, the city has 162 confirmed cases. We expect that number to increase pretty significantly now that we're doing testing by ourselves, and we have more clarity around what the depth of the problem is here specific in Jersey City. And to give you an idea of the need, when we launched this site yesterday, we opened it at about 2:30, and we had more than 500 people call up to schedule appointments in a short 2.5 hours. And those people are screened, to give you perspective on that, to make sure that they do have symptoms. So the need is very, very large, and we're trying our best to make sure that we serve Jersey City people here and get them tested as quickly as possible. We decided to do these sites because, truthfully, we were struggling with the number of testing that was happening in the state and Hudson County. And we felt that Jersey City needed to have its own testing sites. The site in Secaucus is well-intentioned, but it doesn't really help the people on this side of the county where the biggest density populations are. And we're seeing a big need here. And a lot of people here don't have cars, to be honest with you. And so it was counterproductive for us to push them onto public transportation to get over to Secaucus. So we wanted to figure out how to make opportunities here for people. So we have 2 sites opening today. One is going to be a walk-up facility, which is here, which you're in front of today. And the second one is going to be a drive-through facility on the west side of Jersey City. We did reach out proactively to the mayors of Bayonne and Hoboken and say to them that as we get this up and running, we'd be happy to work with them in order to help getting their residents tested, and we'd pass the fees over to them. The obvious question is, what are the fees? So we signed a contract. We're using the same contract that the state of New Jersey uses directly with the lab. Stacy will speak to that. It's a $750,000 contract, so it is a significant amount of money. We are paying $50 per test. There is no cost to our residents, no requirements for them other than that they meet the screening requirements that Stacy will speak to earlier. What we've said to Hoboken and Bayonne is that we'd be happy to facilitate it for them, and we'll just pass over the cost of each individual test to them so that they could get their residents tested. We're in this together, trying to solve problems, and we're all working together on that. I'm going to turn it over now to Stacy Flanagan, our Director of Health and Human Services. She's the one who has spearheaded this initiative, and we're really thankful to have her leadership here. She's been terrific in making sure that Jersey City has been at the forefront of, virtually every policy initiative that you see nationally. Jersey City has been early, and a lot of that is thanks to Stacy. And so I just want to say thank you to Stacy publicly, and she could give some more insight into the testing facilities today.
All right. Thank you. This actually can't happen without the entire city behind us. So I'm just going to say again, in case you haven't heard, Director Kear's Office of Emergency Management, who has been since January making sure that we have things we need to get this done, and Director Shea and the chiefs. This is not an easy thing to pull off. We have a lot of people that need our help, and we need to really make sure that we can help the people that are in the greatest need right now. So this morning, we're still answering all of the voicemails that were left last night through the night. And we are getting everybody that has symptoms registered at a location. We are scheduled to do approximately 125 at each site, so that we have about 250 tests a day. If we see that needing to increase, we're just going to try to work with that. We're hoping over the weekend we get some of the most vulnerable that just haven't had the ability to make the call yet to get in touch with us. So if you call first, we will walk you through some of the key concerns that we have. There is priority for healthcare workers and seniors, and then we will coordinate your tests, and then we will call you back with a confirmation to get more information so that we can get that information into the lab so that we can get this stuff back to you as soon as possible. So every afternoon, we're bringing the items up to the lab. We're hoping to see a quicker turnaround than what we're seeing at the current labs across the city because they're just overwhelmed. So we went with a new lab. And we're hoping that we still can hit on the 3-day turnaround. So that's our goal. And in outside of that, we just want everyone that does not need to be out to be staying at home. Really, not volunteering for your neighbor. If your neighbor needs help, call the health department. That number is 201-547-5750. If there's a senior in need, if there's anyone else that needs our help, you can find us and link in with us. We will make sure that we get a grocery bag delivered to them. And we will try to get them on whatever food program that we have available, and then other items like the donations that we're getting. So yesterday we got 200 bags of groceries ready to eat from Goya. That's going to our homeless that are being put into hotels as we speak. There's one hotel that's specifically for COVID positive. We got a donation from Bomba Socks. Those socks are going in the bag with some groceries, along with a backpack that we got from Backpacks for Life that work typically with homeless veterans. But they offered them for our homeless so that we can support them. So we're continuing with every gift that we get. We're just redirecting it back into bags for people that need them, and the support services with our driving staff to make that happen.
Thank you, Stacy. I'm going to have Greg Kear, so Director of OEM, come up. One of the reasons that we are ahead of the need for PPEs and emergency equipment is Greg having some great foresight in January, so he could speak to a little bit about the city's readiness with first responders.
Thank you, Mayor. What we had when the actual disease started to come out in November, we watched it. Obviously, we do a preparedness plan. It's part of our shelter operations. So since January, we've been getting as much PPE as we possibly can. Fortunately, we have a dedicated staff in purchasing that's assigned just to helping us with this. They're on the phones all day long. The big issue is that obviously throughout the entire world there's a shortage of this. So as the stuff becomes available, we're getting it out there. To this date, we've pumped out close to 2,000 pieces of PPE, not only to our first responders, but any other city agency that's out there working this operation. We'll continue to do so, and we just have to hope for the best. We're going to make sure that we have the proper equipment in there for our police, fire. And I want to compliment Chief McGill and Chief Kelly for offering support and assistance to this whole operation. Thank you.